This week on the 77% Street Debate.
The people pay a lot of taxes and we actually don't see where the money goes to.
Why do we have to tweet for things to work? Because it was not working until I tweeted.
There's quite a bit of failure in terms of even our assessments of how public resources are being managed.
If I can touch about the health and education, why do we have WhatsApp group to raise funds? Why? If these things are working.
I say to Kenyan politicians, shame on you. If you're embezzling funds in Kenya, shame on you.
The chronic diseases that we're having in Kenya right now, particularly for the minor Kenyans, they are suffering alone.
There is the element that we wanted to cure that problem. Are we there yet? I don't think we are there yet.
Let us bring another government.
Hello and welcome back to the 77% Street Debate. My name is Edith Kimani and this week we are back in my home country of Kenya. And it's in this country that a teenager went viral not too long ago after posting very candid videos of him taking care of his ailing father. Now what happened next is what makes this story incredible, because thousands of Kenyans from online got themselves together and went to this boy's home and got him food, medication, and even got the father a new hospital bed. But the question we're asking today is a fundamental one. What happens when government services are not available? Whose responsibility is it to get them? And the person who helped organize everything is here with us, MC Chris Kirubi. So we'll start with just how it all started.
All right, so Kaluma is a TikToker. He comes from an interior place called Othaya. So the father have been sick for so many years. They have tried all the best to make sure that they get the medication and everything that comes with health. But unfortunately, accessibility is the issue.
Are we talking about healthcare?
The healthcare, the hospitals, let me say the government. They're involved on this. The chronic diseases that we're having in Kenya right now, particularly for the minor Kenyans, they are suffering alone.
So let's finish up the story of Kaluma Boy, as he's now being called. So we saw these numbers, hundreds of Kenyans who just went on their own volition and they really took care of this young man. What came out of it?
We organized ourselves with no leadership, with nothing but one blood, one compassion spirit, and we did it for Kaluma father.
Yeah. Okay, so we're already talking about a failure of services here, particularly in the healthcare sector. And Wendy, we were speaking not too long ago, and your story is truly heartbreaking. Tell me what happened when you went to actually the highest hospital in this country, which is a public hospital, to give birth.
I was 18 when I got pregnant. So when I was 19, when I turned 19, I gave birth to Scott. That was March 2019. And I went to Kenyatta Hospital, but I was neglected. They were saying I was not in pain, since I was not causing drama like other women there. Yeah, so they left me, and when they came back, they found the baby's head already out, but it was too late. So my baby didn't cry, and he developed cerebral palsy in the process. And now I have to take care of a disabled child that way.
I can't even imagine what that feels like. I'm so sorry. That feels like so empty to just say, I'm so sorry. But did the hospital ever even come to you and apologize?
No, when I took the baby back to the hospital, it was 6 months. He wasn't sitting, so we noticed something was off. So when we went back to the hospital to find out why he wasn't sitting, and he was already 6 months, they broke the news to us. They told us the baby developed cerebral palsy in the process of labor and everything. But they were not sorry, because according to how they spoke to me, they told me, you young girls, instead of concentrating in school, you're busy opening your legs to get pregnant. Yeah.
And Gatia, we're talking about healthcare here, but public services are being denied all over the country in all forms. And I know that you also fundraise, like MC Chris here. What kind of work do you do for society?
I'm a volunteer coordinator within a network of volunteers who showed up from 25th of June this year. We went to the emergency medical center and there were no medical supplies. So we asked the medics how we could help. They said, just fundraise So most of them needed either money to be admitted into hospital or money to get into surgery and all that. So we started fundraising for that. So it's all citizen-led.
Okay. So it's interesting you're talking about people who are going back to failed, because the building that we're at right now looks very, very spooky. It's been like this for the last 10 years. Originally, it was meant to become the National Employment Authority headquarters. This is a state that it's been in for the last 10 years. So Esther, when you are looking around as a social media influencer, how does it feel knowing that taxpayer money is either being misused, misappropriated, and it's risking lives?
Mixed feelings, really. It's very angering, and every day we just wake up to new news, new bills, new disappointments, and we don't know where to point our frustrations.
There's a lot of anger. We just need to know where to direct it. Is it all got to do with failure of governance?
There's quite a bit of failure in terms of even our assessments of how public resources are being managed, and this has been outrightly brought about by reports from the Office of the Auditor General that point to a lot of wastage, misuse and abuse of resources.
Yeah. And so how does Kenya rank currently when it comes to corruption? I know that TI does the Corruption Perception Index.
We have 32 points out of 100 in terms of 100 being those countries that are doing pretty well. So 32 out of 100, really, that's a really low mark. Corruption Perception Index looks primarily at public sector corruption. So this points to very critical areas that need to be addressed.
Okay. So let me come to the man who speaks for the government here, the deputy government spokesperson, Mr. Muthama. We're hearing that Kenya is not scoring very well when it comes to corruption, and that corrupt dealings could be costing us this and misappropriating funds that are meant to take care of somebody like Wendy. How do you respond to that?
Corruption actually does quite a lot when it comes to really some of the things that we've seen. Some of the deaths that have been reported, much of it has to do with corruption. We only instituted universal health care a few years back. In fact, 1 year. We are celebrating a year in October.
When you say we've just instituted national health care, it's just a rebranding of the National Health Service, which Kenya has enjoyed for many years.
I think it was yesterday, 27 million Kenyans. This is one of the most progressive places where we've seen Kenyan register in their millions. 27. We've never had another government program that has hit that, apart from obviously from IDs and what have you. But that just tells you there is something that has happened over that 1 year. Now, we can agree on so many things.
Hold on, please, let me just take a temperature reading here. Because we're being told about registrations for a health service, right? But do you trust that this health service will come through for you?
No, I don't.
Okay, we have somebody at the back. Let me just hear from you.
The issue of treatment is now the problem. Yes, there is treatment, but there is no those medication. You can be treated, you can be given any kind of service that you want, but you will end up going to the pharmacy to get some medicines. So that is the key challenge.
I think you've demonstrated something here, that even when the government promises to deliver something, it never happens 100% of the way. That you have to go back to your pocket and supplement it. Yeah? Okay, let's hear some comments.
I don't know how it works, because it works well for some people, and for some people it does not work well. Okay. It's like picky, pokey, whatever it chooses.
So we've been focused a little bit on healthcare, but I want us to move away from that a little bit, Titus, because public services are available across different sectors. So when you look at the figures, what are the other sectors or areas where Kenyans might be getting shortchanged?
So health, of course, is one of the sectors that is greatly affected by low service delivery. But there has also been complaints about education, especially higher education.
Now, when you said education, I had a choir behind me. Okay, tell me.
So when it comes to the education sector, personally, I am a student and I have been affected by this whole, where has the funds gone to, why the lecturers not being paid. It's making us, we won't finish school in time. Yeah. So you're backlogging. We're just seated at home doing nothing. Yeah. And it's not fair.
All right. Anybody else who wants to speak to me about the education sector? Yeah.
Parents are being asked to pay for the national examination. So it doesn't receive funds from the national government. What are we doing about that? Yeah. And every financial year we have a budget, disbursement of money. Where is that money going? Where is it doing? The government needs to put everything transparency. Let everything be transparent and consistent. Then every Kenyan will be happy.
Okay.
I believe most Kenyan politicians speak from a point of privilege. Most of them don't know what the common Kenyan is actually going through, because most of them have the funds to take their kids to Ivy League universities abroad, but they never take time to realize that the common mananchi in Kenya can't even afford breakfast or a three-course meal, within. That's very sad. So I say to Kenyan politicians, shame on you. If you're embezzling funds in Kenya, shame on you.
Okay, Melissa, we haven't spoken to you yet, and I just want to hear if this reality that we're discussing here applies to you. Have you ever been to a place where you're supposed to get public services? You know your taxpayer money should have paid for that service, and yet you're sitting there like, what's going on?
Yes, as early as 2019, when I was like 18, I was supposed to get an ID. And at that time, we didn't really have a fee, but I was actually told to pay like 9,000 shillings so that I could get my ID. The people pay a lot of taxes, and we actually don't see where the money goes to. The health system is messed up. The education system is messed up. It doesn't really make so much sense.
Yeah. Okay, let me come back to Muthama for a second. When you hear the frustration that's quite evident in the people speaking, how does that make you feel?
Actually, very bad. Very, very bad. I went through the same thing. Like what my friend has said, and I agree with him 110%. But also, we need to be very careful about some of the things that we are saying. I had my good lady friend there talking about exam fees. There's no exam fees.
I'm hearing some rumblings behind here. Esther, let me come to you because you seem to have something to say.
Let me go back to passports, because why do we have to tweet for things to work? Because it was not working until I tweeted, and I said, I've waited for 4 months, I've not gotten my passport, so I'm celebrating my anniversary. And then that tweet went viral, and then now they started processing the passports without people paying bribes. Yeah, so that's, I mean...
Okay, let me come back to you.
It used to take people sometimes 2 years to get a passport. Now, you can get your passport between 7 and 14 days. What has happened? Interventions. Right. These things actually are happening and can happen.
Okay. Let me, Ngatia here, in fact, there's a gentleman behind you, Ngatia, who wants to cry.
Yeah, probably should start with him. But because all he's doing is deflecting, right? Yeah. Someone almost lost their child, right? We have people, there's a gentleman behind you who's been dealing with people at the Kenyatta National Hospital for 2 months, every day trying to get them help after they've registered for everything that's being said. Currently, he's fundraising for someone who has a bill of 295,000 shillings.
Let me hear from the gentleman directly. Are you the said gentleman?
Yeah.
Okay.
I am actually, he's even making me sad when I see like a government officer trying to defend what is not working. I can tell you it has been a long journey for me and for most of us here. Because one thing, if I can touch about the health and education, why do we have WhatsApp group to raise funds? Why? If these things are working. Why do even the politicians are being added in a WhatsApp group to at least raise funds for sure? That somebody is in the hospital is stacked.
Okay. So thank you for that input. So because you mentioned being in WhatsApp groups and fundraising in a digital space, how many of you have been added this year alone to at least one WhatsApp group to raise funds? Okay, what was it for? Let me hear from some people who haven't spoken yet.
One time it was for a relative of ours back in our rural area. They weren't feeling well, and they were going through leukemia, which is tough, especially if you don't have the funds to pay for treatment.
So some more fundraisers this year. Esther, I saw your hand go up. What were you fundraising for?
My uncle was unwell. Yeah, so we were just raising funds for the hospital bill, but also a lot of fundraising for funerals as well. Yeah.
The worst experience about fundraise, I've been helping people on TikTok, and thousands of them. But this is the most heartbreaking time. When people are calling for help and you cannot manage, because how long are we going to keep on doing the fundraise? And then the next morning they're texting you, we approached you, Chris, to help our uncle, but he passed away. Thank you for lifting us out of this. Then you're like, am I the government? Who voted for me? Am I level 5 hospital or level whatever? And that's why, by the way, for information, that's why we are building our own hospital.
So, by the way, what Chris is talking about is a plan that happened after the Kaluma Boy incident, where TikTokers are now speaking about leaving the government out and individually by yourselves coming up with your own self-funded hospital. Is this realistic? Is this sustainable?
It is. It is. This is Kenyans for Kenyans. Actually, tomorrow we are heading to Embu to rescue a kid who is blind, who is fed by tubes, who is using oxygen in their house. The kid is suffering. And they're looking forward for people to come and do this for them.
So let me ask a question about fundraising, because in Kenya there's a word for it. It's called harambee. In Swahili, it loosely translates to coming together, right? So we understand this philosophy of coming together, harambee, yeah? So is it a problem if we continue to take care of our uncles, aunties, sisters? What's the issue?
So the singular thing I would ask is there's nothing wrong with us coming together to make the world a better place. Nonetheless, the government was instituted as a framework within which we remit taxes at a certain percentage every month from our income, and the government in the constitution has enshrined that there are certain rights we're supposed to get. I'm always meant to get healthcare, I'm always meant to find good roads and other services. Now, we have created a societal structure that at this point, as we evaluate it, we are looking at over-promising and under-delivering. For example, I would suggest if we find from the audit that a certain percentage of taxes are being mismanaged.
Muthama, I have to come back to you for some remarks, because when you hear young people talk about taking governance in their own hands, that could be misinterpreted, you know? But why do you think they've gotten to this point?
So when we talk about healthcare, when we talk about education, there was a problem before these interventions came into play. And you see the Harambee thing, for instance, in matters healthcare, we wanted to cure that. For instance, I was, like you're saying, you're right, I was in about 10 WhatsApp groups, probably one for funeral, there's this one that needs this, one is going for treatment abroad. There is the element that we wanted to cure that problem. Are we there yet? I don't think we are there yet.
Let me get some responses from the. Oh wow.
Back to the funerals. Let me tell you something. If you want to know that the health sector is just as dead on arrival, you cannot bury your person if you have balances in that hospital. You cannot.
Yeah. Okay.
Even the dead. What about the living?
So I think the government is busy procrastinating about what's happening and is fighting information war against the citizen. Instead of employing replicating what the citizen are doing and pushing the agenda further. I think we are fighting each other.
Oh, so you feel like the government is fighting the people instead of working with them. Okay. All right.
I also feel like there is foreigners that come into the country with the aim of helping sectors like the health sector, the education sector, but then they are heavily taxed and they're not able to provide the assistance they needed. They take it right back where they came from because they're like, okay, clearly you don't need help. And I wonder, why is it that the sectors that are we're keeping being told the health sector is fine, the education sector is fine, but as citizens that are experiencing the issues in the health sectors and we're raising these issues, why is it that we cannot be heard? It was for our benefit, and we're saying it's not helping us. It's not working.
All right, but when Mr. Muthama was speaking earlier, he said, if you're not getting a government service, just speak up.
But speaking up, of course, and we have been at the forefront of supporting citizens to speak up. There are a lot of citizens that are speaking up, but there is also the issue of one of the participants pointed out, we have buildings, but it's procurement-driven budgeting. So the services are not there. You get good buildings. This building that we are in clearly shows you that there was just the need to have this settled, the kickbacks and all that, but not the service that is supposed to be provided for this locality.
Yeah. So when I said that Mr. Muthama said speak up, you nearly killed me. I'm just the messenger. I'm just the messenger. And Esther, you were one of the people who was like, what?
Because Edith, you have a job. Yeah. You don't stay at home and then wait for somebody to tell you, Edith, you're supposed to be hosting. Why are we not seeing you in our screens? So it's so hilarious for somebody to say, speak up, when that is the job. Mm-hmm. Like, you're meant to do this job whether we tell you or not. So what I'm hearing is, we don't have ideas, we don't know how to run this thing, so tell us how to run this thing. Yeah.
Okay. And it's not like we've never spoken up. We are literally right now we are doing it. But what has that gotten us? It's not like we are not doing it.
So let me hear some closing remarks because this debate can go on and on and on, right? So I want you to help me answer this singular question. We've agreed that Harambee is part of culture, it's part of society, but government services have to be delivered by government. So where's the balance?
We need responsibilities, both from the government side and the people's side. And we have a very good constitution that gave us power as citizens to exercise our democratic rights through different channels. Citizens are the government, not those people who are in those offices. Those people are just there in temporary. So we need to speak out, we need to come out and ask them question. Why are you not doing this? And we allocated the money for those things. Why do we have double allocation in a projects that is being done, especially in the health and education? Those are the questions, hard questions we need to ask those people in the office.
Fantastic comment. Who else has some suggestions? Yeah, let me hear from you.
We have politicians in this country who take healthcare from outside the country. Why would you go outside the country and risk your life if your country has healthcare?
Why are the kids going abroad to Ivy League universities if our education system in Kenya is working just perfectly?
Okay, let me ask Muthama first if his children are in school here in Kenya.
Oh, definitely.
All right, he needed to finish his comment. Let me just come back to him.
Secondly, the government disappears with about 40% of your paycheck. They need to explain where this money is going.
Are you talking about taxes?
Yes. Me and you wake up every day to go to work, and these people take 40% of the hard-earned money that you have in your pocket, and then it disappears. What is going on in this country?
But do you agree with what the contributor there said, that it's also your responsibility to ensure that you follow that money right up until it is a service to you?
I agree that we are part of the problem in that we are not following up. But if the money is being circulated in ways that you cannot see, how am I supposed to know? As a common mwananchi, how am I supposed to know that the government gave 3 billion to a hospital that does not exist? Where do I have records of that?
Fair point. So let me get 2 more points and then we'll get some closing remarks.
Look at people who are being abducted, who are being killed, who are being arrested. And now when we ask, we are told that we are anarchists, right? As we speak right now, there are people who are lost. The life of Njagi, you don't even say anything about it. The only thing, everything is working. Again, when you tell us about Kenya moving to Singapore, are you okay about this? Because it cannot move, because who are the billionaires in Singapore? Who are the trillionaires in Singapore? They are professionals. They are people who have earned that with their degrees, masters, and their profession. But come to Kenya, we want to move to Singapore. Who are the billionaires? The politicians, of course. The most corrupt people, they are the billionaires. How will you tell us, surely, that Kenya is moving to Singapore when right now we are fundraising for somebody in the hospital? There was a disaster, and it was declared that. But we are people, we are supposed to be buying medicine to them. So when you tell us it is working, it is not working. We are raising funds right now.
All right. Because of time, we have to wrap this up, yeah? So let me ask a simple question. Do you think the future of Kenya depends on Harambees, depends on crowdfunding? Is that the future of Kenya?
The government should take initiative to stay accountable and transparent. We need to know where our funds are going because, yes, we are young adults, but our parents are the ones who are going through all these things. They're not able to give us, even some of us, to get the basic needs. So I just want the government to take initiative and accountability to show, because as a country, we are the ones who put you there. So it's just best for you to do what's best for us.
Okay. This government building here, 10 years in the making, this is 2 government regimes who so far have been unable to get it off its feet. Are you confident that perhaps the next round of leaders are the ones who will be able to do something about it?
Yes, if we wake up, go and take those votes, register as voters, let us bring another government.
All right. Some more solutions, please, before we wrap up.
Till when will we become a begging nation? Till when will we walk around with a begging ball? I think it's time we have leaders who are accountable. Elect leaders who have ideologies, not tribal-based politics. We should focus more on people who have ideologies to make sure the economy grows. The people of Kenya actually feel the impact of good political governance.
Okay. Some more solutions?
A solution to the government: do not fight us. Do what you're supposed to be doing as a government. When we speak out, listen and actuate this.
Okay. Finally,
maybe my last parting shot is we need as citizens, as far as government is concerned, we need as citizens to take our responsibilities. One, in Kenya, we have one of the best policies actually the constitution and the policies, but the implementations of these policies is the biggest elephant in the room. So we need to enforce the implementations of these policies, be it in education, in health, in all sectors, so that we as citizens can get the right services that we want. But if we sit in our comfort zones and expect government to do things, they will also continue with their normal shenanigans of eating and looting and going home. We should not be changing people, but we should be changing the system. Okay. If the system remains the same, even if we bring whoever is clean as snow, we will never treat the problem that we have in those systems of the government.
Okay. So, Mr. Muthama, I want to give you a chance to close this debate off for us.
When I said speak up, you must continue speaking up, and I'll tell you why. Your vote is the best thing you can do to speak up. Yeah? Use it and use it wisely. All right? So, but one thing we need to realize, we don't get leaders, we don't outsource leaders. Right. Guess what? They come from us.
All right. So, what an interesting debate. I thought we were going to be talking about public services. I thought we were going to be talking about roads, hospitals, and schools. But instead, what this issue has revealed to me very, very closely is that this is an issue about governance. Thank you all for watching.